It is very important to understand who are the people more prone to get lumbar canal stenosis or disc prolapses. There are many factors that can lead to this problem. If we take the common habits, if a person smokes a lot, he is a person who is more prone to get this problem. The reason is smoking in long term can cause ischemia, that means less blood supply to the disc. So the disc nutrition get affected, and as a result the discs get dried up, and dried up disc doesn't fit to the space between the vertebral bodies that lead to disc prolapse. Sometimes people's behavior can also lead to lumbar canal stenosis. If we take, for example, if a person who is carrying heavy weights regularly and has to work bending his spine regularly, can get wear and tear happening faster than a normal person. At the same time, if a person is always be in a wrong posture, such as an office worker or a heavy manual worker, sitting in a wrong posture can lead to overstraining of the joints in the lumbar spine as well as the disc spaces. When the straining is too much, the wear and tear is more. As the wear and tear goes on, the lumbar spine get unstable. To protect the spine of becoming unstable, the ligaments and the tissues start to thicken. That's a protective mechanism. However, unfortunately, this thickening happens inside the canal. Once this thickening happens inside the canal, the space available for the nerves will slowly get smaller and smaller. At the same time, the nerves which are coming out from the spinal canal also can get compressed due to the hypertrophy of the facets, that is the swelling of the facets due to thickening of the tissues around the joints. So these are the conditions that can lead to compression of the spinal cord as well as the nerve roots coming out of the lumbar spine. And sometimes some exercises such as rugby and football as well as weightlifting can lead to increased wear and tear in the lumbar spine. As we all know, these sports are done in the young age. At that age period, people does not realize that it can lead to further consequences in their later life. However, when they are doing, especially if the exercises are done or the sport is done without warming up of the tissues, without warming up of the muscles and maintaining the correct technique, it can lead to muscle damage and the tissue damage. These tissue damages ultimately make the spine unstable. Instability of the spine, especially in the lumbar area, will lead to excessive mobility, and then thereafter the tissues start to thicken. So these two conditions, together with diseases that make the degeneration process faster, such as diabetes mellitus, and if a patient is on long-term treatment of medications such as steroids, and if a patient is chronically debilitated due to an ongoing illness, their health in the lumbar spine can get deteriorated. As a result, the spine can get unstable, and as a result, the tissues can get thickened, and thereafter, the nerves as well as the spinal cord can get compressed. Therefore, we need to understand it is very important to maintain the posture and maintain the health of the spine as well as do proper exercises to maintain the spine.